Haas is an international advocate and trainer on using a trauma-informed approach, the Adverse Childhood Experiences, or ACEs study, and Positive Childhood Experiences study. She is a pioneer in creating trauma-informed communities. Work she led in Northeast Tennessee was recognised by SAMHSA in 2018 as a model for other cities to follow. In 2019, she co-authored the Building a Trauma-Informed System of Care Toolkit for the Tennessee Department of Children's Services, detailing a blueprint for creating community resilience. This toolkit has been featured in the global online publication PACES or ACEs Connection, Growing Resilient Communities, as well as recommended as a practical tool in Johns Hopkins' Progress in Community Health Partnerships, Research, Education and Action. Becky is the author of several sector-specific professional development trainings, with 2 receiving statewide accreditation in Tennessee as evidence-based training. Among the diverse sectors of professionals she has trained, she is uniquely distinguished for her work training police officers and others in the justice system to understand trauma. She has been certified by SAMHSA Gaines Centre as a trauma-informed care trainer, earned her professional certification in trauma and resilience from Florida State University, while completing additional certifications from Texas Christian University, Star Commonwealth, and from the International Association of Directors of Law Enforcement, National Association of Chiefs of Police. Becky is an East Tennessee State University Ballard Health Strong Brains Institute Fellow and a member of the National Trauma Campaign Strategy Team. What a list of credentials. We're so grateful to have Becky Haas here in Australia with us this morning, and I will hand it to you now, Becky. Thank you.
Oh, thank you, Sue, and thank you, Mike, for your kind words and your visit, and hello to everyone that is joining. So if I get mixed up because it's tonight here in the US and in the morning there, I ask just your kindness. I may be all over the map, but it's really a joy to share with you tonight. And I really feel like we've known you. I've known you since Mike's visit. I could tell when Mike came and expressed the energy that Sue and Brigid and the others shared. I knew that this was a kind of a sister coalition and people with sharing the same heart and understanding and love for your country and your community, and seeing many of the traditional approaches not fixing it or not changing addiction and things like that. So what I'm going to share with you tonight, I was working for the Johnson City Police Department. We're in Northeast Tennessee. We are a town about 70,000 people. And I was hired to reduce drug-related and violent crime, as well as to oversee the development of a program, and some kind of new program that would reduce recidivism, which recidivism is a rate every state in the US is given, that when someone is incarcerated and they get out, within 1 to 3 years, they go back. And in Tennessee, the rate is 50%, 48, 50%. And I'm really honored the program that I oversaw development of. If people go there instead of back to prison, it cuts it to 21%. So I was very involved with the justice and people involved with drugs and crime and neighborhoods with teenage pregnancies and alcohol abuse, teenagers dropping out of school. And it was in that context that I learned about ACEs. And maybe another time we can have a visit and I can learn about how each of you learned about ACEs, because I've been a trainer and a training developer all my career, 40 some years of a career in different topics. And I never heard anything that really impacted me the way the ACEs and trauma-informed care did. And so being that I was working with those in poverty, people, children in schools with caregivers who are drug addicts, incarcerated caregivers, I wondered why no one was talking about that. And I just set out to make a lot of noise. So you may be the governor of your town, or you may be a social worker, or you may be the neighbor next door. And I'm wanting to encourage you tonight that whatever your role is in TANA or in your community, you can make a difference, because you're hearing tonight from the lady that was the least likely to do the things that Sue read. I'm always surprised that that's my story as she shared. So I never really set out to be sharing with people around the world and across the nation. I just set out to see that this generation in Tennessee would not be lost to addiction, because that's what our elected officials said would happen. And that's the generation my grandchildren are in. And I said, no, not on my watch. And I just started making a lot of noise. So what you're going to hear tonight is, well, in your morning, what you're going to hear now is what the training that's going to be offered here in a few days, that Dr. Clements and I wrote this training, and then she and I, on top of our busy day jobs, without any funding and without, it being our full-time job, we trained over 4,000 professionals in 3 years. And I'm going to show at the end photos of what they began to do. So if I was a cook tonight, I would be having you online to share with you our award-winning cake recipe or some kind of recipe. And this is a recipe that really has stirred a lot of people, from our healthcare to our university, and that's what I'm going to share. So I hope some of you can attend the training when we do that in a few days, and then you all will have some of the tools, and it gives me real joy to help you to have some of the tools to help grow your work. I'm working with people in France, in the UK, in Lithuania. It's just amazing. All right, so here we go. Okay, so this is our story, our recipe that you can duplicate there in Tasmania. So what is trauma? SAMHSA defines trauma as an event, a series of events that are experienced by an individual that are physically or emotionally harmful or life-threatening. And these events can have lasting adverse effects in many ways: mentally, physically, socially, emotionally, and even your spiritual well-being. So in the longer training, I talk about what could be these events, and then how we experience them, and then what are lingering effects. And I know some of you, if not all of you, are aware of the ACEs study. This is a lovely graphic from the PACES Connection, and it shows three sources or realms of where ACEs can come from. We see household ACEs, things like homelessness, parents with mental illness, alcohol and drug use in the home, domestic violence. And then we see number two, the community. We see lack of affordable housing, substandard wages, lack of job, food scarcity, poor water and air quality, violence, historical trauma. And then we see environmental ACEs, which, right now we've all around the world just been experiencing a global pandemic. And one thing I want to point out is, in the pandemic, it's been so public. And here in my town, every day the healthcare is talking about how many now are in the hospital and how many have died. And it can certainly be wearisome, but also many of us have had family members to go through COVID, or maybe ourselves we have. But it's, what I want you to see is it's very public. But when someone's experiencing domestic violence in the home, or living in the home of an addicted caregiver, that's very private. But what we want to see today is that trauma impacts us, whether it's public, whether it's private. And as a community, we need to find ways to reduce the effects of that trauma. Okay, so one of the most famous graphics that came from the Adverse Childhood Experiences study that was done in the late 90s, and in the training, I'll talk more about it, but is this pyramid. And this pyramid really illustrates how that when life is filled with adverse childhood experiences, it leads to disrupted neurodevelopment, and that's going to lead to social and emotional cognitive impairment, and people then using unhealthy coping skills. See, all of us that are on this call today, we've all experienced bad things. But when we experience bad things, hard places, if we have a loving adult in our life, a parent, a grandmother, a teacher, a coach, now the ACEs study showed us that those things the effects of them can be mitigated or reduced. But when bad things happen, all of us have to cope. And if we don't have healthy ways to cope, then people are going to choose unhealthy ways to cope. And that is a huge explanation for a lot of drug addiction, alcohol use, teenage smoking, teenage pregnancies. These type of at-risk behaviors are a type of coping skills for individuals that are born in a home with household dysfunction, in a bad environment, because, community members, you don't pick where you start in life. And as I navigated, particularly my job at the police department, I met people whose youngest memory of their mother she was a heroin addict. And when she would shoot up with drugs, she would get very sick. And this little child would be pulling her out of the toilet while the older sister's just screaming, let her drown, let her drown. And this particular woman, one time her mother was gone for 2 weeks, and her sister was 8, she was 6, and they had a 4-week-old baby sister, and they're holding a mirror under the baby's nose, looking to see if breath is coming out. And I wondered that day, who leaves these little girls with a new baby? And I said to that woman, I said, I'm so sorry that that's your story. While you're here in our police, prison diversion program, you have counseling, you have services to help you to navigate your recovery, because she would be there for over a year. And the next time I was over there, she handed me a little note, and the note said, thank you, Miss Becky, for treating me like a person. And, even though trauma is not an excuse for drugs or crime, this pyramid right here explains is big explanation why we see so much drugs. And then when I know from working for police, once you get in a lifestyle of drugs, then it's going to usually introduce you to the justice system. So the adverse childhood experiences pyramid from the ACEs study showed that when life's foundation is ACEs, it's going to lead to the adoption of the health risk behaviors. And then that's what's going to lead to disease, disability, poor health, and early death. So that upper part there, that's why I was recruited by a healthcare system. And we'll tell more about that later. And then one of the things I really want to make clear is that Mike and Brigid and Sue, this is not just a movement. This is not a fad. This is science. This is science. And many things that are evolve and develop to bring new technology, new medical cures, and things like that. It's all based on science. And one of my favorite quotes about this work is that the electric light bulb did not come from the continuous improvement of candles. One day, somebody had to look a different way to get an electric light bulb. We could keep improving the candles, but one day there were people that said, you know what, there's got to be a safer way. There's got to be a better way to light up. And I may mess up my history here, but I think either Edison, Westinghouse, the Chicago World's Fair back in the 40s is where they displayed what it would look like to light up a community. But somebody had to look a different way. So this slide, whenever I go before elected officials in the United States, I bring this slide right here. So these are PET scans, MRI of two different children the same age. One is labeled the healthy brain, and you notice the circle area, that's the cortex, that's the upper part of the brain for which a child needs to be ready to go to school, has to have that part developed. So see how brightly colored that part of the brain is. So this is a child that has nurturing caregiver. At least one, that's interacting regularly with the child, making the child feel safe. But notice on the other side, it's called an abused brain. I would say maybe it's a neglected brain. This is a brain of a child in an orphanage in Romania, where there are very few, maybe 5 or 6 caregivers to about 200 children. And though the children are kept safe or kept in a building with a roof and food and clothing, they don't get the one-on-one attention of a caregiver. Now, folks, this is science right here. And this is why teachers in America at times are struggling to teach children. And in America, schools are funded and teacher promotions. All of that is based on student scores. But without knowing this, we don't know that children are coming in at the same level, ready to learn. But the good news is we can do some things to fix that, okay? So what is trauma-informed care? Well, trauma-informed care is an organizational approach that focuses on how trauma may affect someone's life. And now what we're going to do is offer services through a trauma lens. So today I'm passing these glasses, so to speak, all the way to Tasmania and handing you the trauma glasses. And that's what we did. And I'm going to tell you here as we go, our story. I could have never imagined the wonderful, inspirational things people began to do when we handed them the trauma glasses, okay? So a trauma-informed organization realizes that there are a lot of people, 70% in the US of people are trauma survivors. And we'll talk more about that in a minute. But the good news is there are paths for recovery. Though ACEs may be fact, it's not fate. Where you start in life might be poor, but we can help you have a better finish in life. And that's the mission of TANA and those of you that are already having this conversation. And then training helps us to recognize the signs and symptoms of what trauma looks like in lives. And then we also respond. Sometimes I end my training by saying, tag, you're it. In other words, you do something now, you do something, okay? And organizations and communities begin to rethink doing business as usual, and they consider the pervasive and harmful impact of trauma, and they find ways to offer services without re-traumatizing people. So in 2014, when I first learned about ACEs and trauma and resilience, I was working for the police, and the Substance Abuse Mental Health Services Administration, which in the US is the largest federal organization. They put, millions of dollars into each state. Tennessee, I think last year got 65 million. Each state, it's the largest federal organization that the government uses to address addiction and mental health. And they wrote a paper about a trauma-informed approach, and they made this recommendation, and I can share that whole report. It's about 20 pages. But they said communities should address trauma through a multi-agency public health approach, including public education, awareness, prevention, early identification, and recognizing what are effective trauma-specific assessment and treatment. So in the United States, if that kind of guidance comes from SAMHSA, I figured everybody was doing it. Well, that's the part I didn't know. So in 2017, after training over 4,000 professionals, and as Mike said, I began to write trainings. You know, the first time I heard about ACEs and trauma informed care, nobody had to tell me twice. I believed it. I believed that it was important. What I wanted to know was, what does it look like to doctors? What does it look like to teachers? What does it look like to police officers? And how to become a practitioner, how to get it out of theory into practice. So back in February, I spoke with Dr. Warren Larkin to the Academy of Social Justice in the UK. We had 450. It was sold out in 2 hours. And 450 leaders in the UK, and they stayed on at the end for almost an hour asking questions. And I share this very story I'm sharing with you all. And they said, Becky, we have known this on a scholarly level, but we've never seen these photos. We've never seen it practiced. And it really encourages us to see that a community can begin to practice this. So in 2017, we wrote SAMHSA and said, you know, we'd like to meet other communities that have been training their town as you recommended. And this is a part of the letter we got back. Though many communities across the nation are implementing these SAMHSA recommendations, Johnson City clearly stands out as a leader in embracing this model. And that was the first time I had any idea that we'd done anything that every town in America wasn't doing. I had no idea that until that happened. So instead of having a webinar, we had a forum, and people came from SAMHSA and Dr. Joan Galeese. We had two governors' wives. There's me with Tracy Carney on my left there in the blue, and then Chrissy Haslam on the right. She, at the time, her and her husband were governor and first lady of Tennessee. Miss Carney is governor, wife of the governor of the state of Delaware. And when Miss Carney left our forum in September 2018, she went back to Delaware, and her husband, John Carney, signed Executive Order 24, saying if you do business in the state of Delaware, you have to be trauma informed. And she wrote this very kind forward for our toolkit that Sue mentioned. Sue's, I know, has a copy of it. We can share it. It's all electronic. But Miss Carney said that the Johnson City model was a tremendous inspiration. So I've been to Delaware 4 times. I was just there, matter of fact, in September, training the Delaware State Police. And I was training the police for the Delaware Department of Education, because the Department of Education has been working to create trauma-informed, trauma-sensitive schools. But in the US, most schools have police officer presence, and you're not going to be able to create a truly trauma sensitive school unless you get the police trained as well. So I was up there. And so Miss Carney's become a real dear friend, and she's a really good leader in the United States of her work in the state of Delaware. And so in 2012, under President Obama, there was a attorney general appointed a task force to look at violence against children. And this is an excerpt from that. And this is all the things that I became aware of and began to feel my thought process of why we needed to educate our community. And so this report said in 1979, the US Surgeon General, he was under President Jimmy Carter, he declared violence a public health crisis of the highest priority. And community members there in Tasmania, we are 41 years later from that. What if we'd have been that way with COVID-19? What if we'd have been that cavalier in our response to this global pandemic? But you know what happened in our community when people began to get tested? You would drive around the back of a business, and the National Guard would show you where to park, and a little nurse all covered in protective gear would come out and test you. And then when they offered the vaccine, we would go to another area. In other words, in order to defeat this public health crisis of COVID-19, we did new and unusual things because it was a crisis. But why? Why have we taken so long to address the crisis of violence against children? So we're long overdue for a national awareness campaign. And that's exactly, I know, the heart of TANA. What TANA wants to do in your community is to raise awareness of this. So in the US, other national campaigns have been tobacco, seat belts here, hand washing, certain things like that. We've seen other types of national campaigns. Well, that's what really is taken off in a big way in the United States. Okay, so some of the other things that I began to see was that trauma impacts my community. We see that SAMHSA, the Center for Disease Control, and very notable drug recovery programs. If you go to their website now, they all list childhood adversity as a significant risk factor to addiction. In 2019, a report was released where they collected ACE scores on adults in Tennessee, not all the adults, but they did a sampling of 3 years, and they found that 17% of Tennesseans had experienced 4 or more ACEs. And this report went on to conclude that ACEs among Tennessee adults led to an estimated $5.2 billion in direct medical costs and lost productivity from employees missing work. And so we began to see the cost of people experiencing trauma, and it helps us to see why we need to have more resilient communities, more resilient organizations. And then this really hit me hard because I was working for the police department. And as I began to research, is imprisonment fixing drugs? Well, in America, in 2014, an organization called the Pew Charitable Trust, which is really one of the most reputable organizations in the US for studying incarceration, it showed that prison data showed no evidence that incarceration reduces drug misuse. And ironically, they compared Tennessee to New Jersey. Tennessee is the 5th highest state that uses incarceration as a means of trying to reduce drug crimes, and New Jersey is the 45th state, but yet both states continue to grow at the same rate of drug use. In the last 20 some years, see, the US has 5% of the world population and 25% of the world incarcerated population. I've sat in city commission meetings with local elected officials talking about how much it costs. It's $80 a day in Tennessee to incarcerate someone for 1 day, because when they're incarcerated, you have to pay for all the clothing, all the laundry, all the medical, all the dental, all the food. I mean, and that's $30,000 for a year. And in a minute, we're going to talk about upstream approach. And so even economically, ACEs science is a good approach for any community to use to reduce these challenges that are being faced by every community in the world. So while we continue to pound the pavement of incarceration is not fixing or reducing drug addiction. Matter of fact, when I worked at the police and we created that prison diversion, people in it would say if they failed a drug screen or violated their probation and we're going to go back to jail, they'd say, just send me back to jail. There's more drugs in the jail than I can get on the street. And that is a known fact in the US, that drugs really make their way into the jail. And then homelessness, I headed the homeless task force in my community, working right with the mayor and the city manager. And the American Journal of Public Health in 2013 said of all the causes that are linked to homelessness, childhood adversity, this population have substantially overrepresented samples. In other words, homeless individuals have the highest ACE scores of any population. And so the Bill Gates Foundation on Ending Homelessness says we can't ignore the piece about trauma as a strong factor leading people to homelessness. And then Dr. Fletty and Dr. Anda did another study after they did the ACEs study, and this involved 125,000 patients in the Kaiser Permanente health plan. And they found that when you just included the ACEs study as a part of a medical history and just discussed ACE scores with the patient and thought of their whole life instead of just the illness or the injury they were presenting there that day, they saw a 35% reduction in doctor visits and an 11% reduction in emergency room. So see, whether it's health, whether it's addiction, whether it's incarceration, we see now the science that there are positive outcomes, much more economical outcomes coming from addressing childhood trauma. So now these are numbers in the US, but I'm pretty certain that these numbers could be duplicated in Tasmania. Around 65% of all substance abuse treatment clients all report experiencing childhood trauma. 75% of women in substance abuse treatment have histories of trauma. 92% of homeless mothers have severe trauma histories. 71% of children exposed to violence. 3.5 million to 10 million children witnessing violence against their mother. So last year, some Lithuanian students reached out to me. If you Google what country leads the world in death by suicide, it's Lithuania. In 2013, 1 of every 3 individuals in Lithuania ended their life by suicide. And until a few years ago, domestic violence wasn't even a crime in Lithuania. Literature that I've studied about Lithuania says the most dangerous place for a woman in Lithuania is her own home. And what's happening that contributes to the high suicide rate is many children are growing up in generational cycles of seeing violence in the home. And so we've been working with, actually now the Red Cross has written a grant. I'll likely go to Lithuania next spring in May to be doing some training in person. But what is working to reduce suicide here as an upstream approach, I know the same things can help in another country. 1 in 4 girls, 1 in 6 boys are sexually abused before adulthood. And then in juvenile justice, 94% of the young people in juvenile justice all have histories of trauma. Now, let's look at some data that TANA shared with me. So teenage pregnancy rate, remember when I shared with you the pyramid that we see when life is filled with adverse childhood experiences, it's going to lead to that brain derailment of development, and it's going to lead to unhealthy coping skills like teenage pregnancy. So Tasmania overall rate is 15.4 per 1,000, which puts you at a very high spot compared to other communities in your area. And this data Sue shared with me, so came from a reliable source. And then teenage pregnancies are also contributing to another factor of low birth weight. And then that would bring about later health problems. So the more teenage pregnancies that are also, it's not just the teen pregnancy, but those babies are going to be born more likely with a low birth weight. And a contributing factor to that low birth weight is the mother smoking. And in Tasmania, the smoking rate among teens is almost 42% compared to the national average of 33. So do you see why TANA exists? I mean, TANA exists because the same reason we're doing this work here in the US and the national campaign that I am part of, and the Strong Brain Institute, more and more communities are seeing we all are addressing the same things, and we're finding that these unhealthy lifestyles, these risky behaviors can be linked to childhood trauma. So drugs, alcohol, and incarceration in Tasmania. In Tasmania in 2019, among people aged 14 and over, 1 in 4 consumed 5 or more drinks in one sitting, at least on a monthly basis. 1 in 6 used an illicit drug in the last 12 months, and more than half supported testing of drugs and pills at designated sites. And then incarceration, Tasmania imprisonment rate is 124 per 100,000 population, which is a rate higher than most comparable jurisdictions in Western Europe and Canada. I hate to see any good news in this, but United States is way over the top of that. Even though you may be a country that's coming up, but when I was looking at the charts that Sue sent me, you know, it's staggering to see how much farther out the United States is. But as far as, you know, in your community, it's still something, a challenge that must be addressed, is these growing incarceration rates. So trauma is not an excuse for drugs or crime, but the Adverse Childhood Experiences study, not only did it shine the light on what childhood trauma can bring about, but it showed us that there's a way what's predictable is preventable. Okay. And it showed us an upstream approach. So a public health story that's very well known in the United States, and this is the Tennessee version from Becky, is that there was a man fishing in the river. Today I was riding my bike about 20 miles down a mountain. Just so lovely. We have beautiful fall colors here, and it ran along a stream, and there were several people out in the stream along the way fishing, trout fishing. But in this story, there's a fisherman fishing, and while he's fishing, he hears cries for help. And being a kind gentleman that he is, he looks around and finds that while he's fishing, someone fell in the water and they can't swim. And so he just drops his fishing gear and he swims over to where this person is in danger, and he pulls them safely to shore. But the problem is, about when he gets them safely to shore, now he hears more cries for help. Someone else has fallen in. So he swims back out and pulls the second drowning person to the shore. But when he gets the next one there, here we go. Now we have two people that have fallen in. And the man does this for several hours, pulling in people drowning. And he's exhausted and he's all alone. And now it's getting dark and the water's getting cold. And every time he rescues people, there are more that are falling in. So he sees a man up on the road and he calls out and he said, "Can you go see why people are falling in the river?" And the man runs down the road, and in a few minutes he comes back and he calls out, "The bridge is broken. The bridge is out." And so community members in Tasmania, that's what this is. This is going upstream. And all of a sudden now we put on our hard hats and we get our tools and we're going to go fix the bridge, because now we see that's why the people are falling into the mental health, into the addiction, into the teenage pregnancy, into the teenage smoking, into the lower birth weights of babies. And so this provides every community around the world with a scientific upstream approach that we can take to, instead of keep trying to make better candles, that we can begin to use an electric light bulb. So in 2005, at 72 years old, my father died alone of a heart attack. My mother and he had almost been married 50 years. We already had a party planned for him as a surprise. And my mother went out for several hours to run some errands. And when she came home, he had died. And one of my brothers, he's very involved in country music, or he was at the time, and he took some time off after Papa died, and he raised money to place AEDs. And, you know, when you think about an AED, you know, 20, 30 years ago, when they began putting them out in bus stations, airplane terminals, shopping malls, college campuses, what they did is they put life-saving medical equipment in very unusual places, but they trained people there how to use it And it saves thousands of lives. If we would have had an AED the day my father had a heart attack and somebody was handy that knew, had training, they could have possibly prolonged his life. And so I began to think about, what if we are looking at childhood trauma like being in front of a building, a very large building, and this building is on fire, and we have children, their little faces, pressed against the windows in the building. And it seems like since that report was written 41 years ago, it's like, well, we pulled a few out in our generation. We'll just let, these others just go, and maybe some more will be helped next year. Well, TANA, folks, that wasn't good enough for me. That wasn't good enough for me. How could you walk away when you know what childhood adversity is going to do possibly in the life of a young person without the support of the community? And so what I decided back in 2014, if I can't get in that building and rescue those children, just like the AED, then I'll train you, 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 I'll train you. And then somebody is going to get there and help that child. And about the time I was thinking about all this and formalizing a plan, there was a terrible, terrible car wreck in Tennessee. It was in Middle Tennessee. It involved two big tractor trailers and 26 cars, and it made the national news. And these cars just piled up, and many of the cars were on fire. And that night on the news, they interviewed a man, a good Samaritan, first man that came upon this horrific wreck, and he was not a part of it. And he just saw these cars on fire and people hurt. And he began to run from car to car to car and see who could he help and pull people out to safety. And you know what? Nobody in those burning cars said, hold on, mister, we're waiting on the fire department. You just leave us alone. No, they were so grateful that somebody came by with a kind word or a mentoring. And see, when we create a resilient community or resilient organizations, Bruce Perry, I heard him say on a podcast the other day, and Bruce Perry, Dr. Perry's big in this conversation. I mean, one of the leading, kind of the think tank, but he said more healing happens with a coach in a locker room than many times in a counseling office. And so resiliency can begin to happen in many, many places. So just like that young man saved the lives of many people in that wreck, just like AEDs could save the lives, the key is bringing about training. All right. And so just recently, matter of fact, earlier this week, I was speaking in Indiana at a conference, and Dr. Christina Bethel, she was speaking about her positive childhood experiences study. And she's a doctor at Johns Hopkins, and she took 6,100 surveys of adults in the state of Wisconsin that had A scores, and she began to look at that data, and her just real recent work has been published, and it's called the protective childhood experiences. So while we know what the adverse ones will do, she created this great piece of hope by seeing what will protective childhood experiences do. And what was learned is that kids that experience many positive childhood experiences, they become adults that know how to ask for help. Even if they have mental health or even if they have problems, they know how to ask for help. And that what she found is that the dose response between positive experiences and good mental health is the same as the adverse ones for the negative circumstances. And so the 7 positive things that she identified in this, looking at this data, and if you look at this list, this list is not very costly. All of these things, some of these things can just be, we can advocate, we can raise awareness. And I know that's what is the heart and the mission of TANA and those of you today on this call. So the ability to talk with family about feelings, you know, the ACEs study shined a light on how important social connection is. And then another one was that you feel your family is supportive in difficult times, that you enjoy participating in community traditions. And I don't know all of the history about Tasmania, but I know there's got to be some very special community traditions. And I'm sure maybe in a pandemic, you don't celebrate them like you normally do, but you know, I do feel more communities are opening up a little, and eventually I think we will get back to more normal things, but that to enjoy these community traditions and a feeling of belonging, particularly in high school, a feeling of being supported by friends, having at least two non-parent adults who genuinely care. I'm working with a community in Middle Tennessee. I'm working with elected officials. And I told their mayor back in April, I said, Mayor, it's $80 a day to be incarcerated in Tennessee. That's $30,000 a year. Or Big Brother, Big Sister is a nonprofit that's a couple of decades old, and it's $1,100 to have a Big Brother, Big Sister mentor a child for 1 year. And if you go to the Big Brother, Big Sister website, it says 95% of the children that have a Big Brother, Big Sister mentor say, we now have an adult who genuinely cares about us. So community members, you do the math, $1,100 or $30,000. So wouldn't that make us want to consider that we need to see who could be mentors to kids? How can we connect the mentors? How can we help the mentors understand trauma-informed care? Because Dr. Bethel's study showed these non-parent adults that genuinely care, that's part of the cure for childhood adversity. And then the other one was feeling safe and protected by an adult in the home. And so I'm going to show this one little video. And this is an example of how resilience can happen. And this happened in a school setting. It's a true story. Mike ought to like it. It's about a musician.
I have a lot of memories from when I was a child. One that's always stuck out to me, though, was when I was about 10 years old, and I was in school, and I struggled. And I didn't struggle with English, math, or science. I struggled holding still. And I would try to listen and focus and process ideas, but I couldn't help myself. And to be honest, I would sit there, and then I would just start tapping. And the students in the class would look at me, and they'd say, hey, stop tapping. A lot of the time, I didn't even realize I was doing it. And then eventually even the teachers got after me, and they would yell at me, and they'd say, Clint, you have to stop tapping. It got so bad that I got sent to the principal's office for tapping. And he said to me, okay, maybe when you go back to class, just try sitting on your hands. And so I did. I went back to class, and when I felt myself starting to tap, I did this. I sat on my hands. And that worked for about 5 seconds. One time I was tapping in class, and my teacher, Mr. Jensen, he looked at me and he yelled. And he said, Clint, stay after class. And I thought to myself, this is it. I am done. Now, I've always been the type of person that believes that a single moment in time can change a person's life. And this was one of those moments for me. And I will never forget it. And so I was sitting there with Mr. Jensen and an empty classroom. And he walked past me and he sat next to his desk and he said, Clint, come here. I want to talk to you. And as he looked me right in the eye, he said, now I need you to know something. You're not in trouble. But I do have just one question that I have to ask you. And he asked, he said, have you ever thought about playing the drums? And in that moment, Mr. Jensen, he leaned back and he opened the top drawer of his desk. And he reached in and he pulled out my very first pair of drumsticks. And he held them in his hands and he looked at me and he said, hey, Clint, you're not a problem. I think you're a drummer. that moment on, I've never put those sticks down. I've toured, recorded, and played drums all over the world. My whole college education was paid for with drumsticks in my hand. Just because of a single moment in time when somebody believed in me. And he saw something in me that I didn't even see within myself. And from that moment, I learned that there's a difference between being the best in the world and being the best for the world.
Oh, that gets me every time, kind of choked up here. It's just so powerful. But, you know, that little simple story, it showed what Dr. Bethel's protective, positive childhood experiences, that when our protective and promotive factors go up in our school, in our community, in our police, in our homes, like with Mr. Jensen, just that teacher, that instead of seeing the little boy as a bad child, that maybe I could have a moment of inspiration. And you heard him tell in his own words how that changed his life. That when we focus on bringing into our community, bringing into our organizations those protective factors, then we see the risk factors go down. You know, look at how we all understand wearing a mask, social distancing, washing your hands, because that has been communicated and communicated and communicated during COVID-19. But why again are we 40 years in America that the Surgeon General, the top medical, said this is the biggest public health, the biggest health factor facing the United States is childhood trauma. And here we all understand, you know, my grandchildren are little, 5 and 3, and it's, so sad seeing them wear masks and everything. And I think about the 3-year-old that most of his life, he's seen people wearing masks, which that's just sad to me, you know, but in other words, we've been effective in getting that message across that can help save lives and keep us healthy from catching COVID. But what if we begin like TANA is doing and what we've done here, begin to advocate, train, and educate people about these protective factors, like how important nurturing adults and mentors and things are, then we're going to see the risk factors go down. Okay, so this is how it happened. So getting started, this is a cover of our toolkit. So whatever your role is today, you know, again, you may be the next door neighbor, you may be the school bus driver, or you may be an elected official there, parliament, whatever your role may be. But this is a message that's caught, not taught. You know, so we want to talk about a good contagious today, a good contagious, that we're contagious. We're going to infect our community in a good way with resilience and with hope. And so the work in the toolkit that just in December was published by a Johns Hopkins journal, which here in the States, that's not any higher that you get than a Johns Hopkins Progress in Community Health. They recommended our toolkit as a practical resource any community could use. And in that are 3 steps that we took to advocate, to educate, or to collaborate. So not knowing all the roles that you have that have joined here today, but you know what? I dare say that each one of you could do one of these parts. You may be involved in the advocating. You may go to a church, or you may be in a civic group, or you may have a neighborhood group or a workout group, and you can begin to talk about this. And then there's the education and the training, and we'll talk about that. And then you can come back together and collaborate. So here's how we took the step advocate. We began to show films. There's the film Resilience and Paper Tigers. You know, when I first started Paper Tigers, I had to pay about $300 for it with a license, but you can see it on Amazon Prime now, I think for $1. I don't think you can show it to big groups that way, but have friends over for coffee, you know, and begin to start raising awareness. Or you can go on YouTube and find 30 minutes of the Healing Mean video, which I'll show when we do that longer training. And so we went everywhere that we were given an opportunity and started making a lot of noise about this approach. And then we saw people, now what do? We need new skills. We need to know how to make this work. What does it look like for police? What does it look like for mental health? What does it look like for doctors? What does it look like for teachers? And see, the beauty of this is that, I'm working with a national group of universities in the United States. And we don't want to be 20 years down the road and still having to train our teachers. We're working on curriculum so that when teachers go to college, or businessmen go to college, or doctors go to medical school, they're going to start getting this in professional training. But now we're playing catch up, and that's why we're having to train professionals on the other side. But that isn't going to always be that way, but it's going to take time. So I began to write all these trainings, and then I started creating Train the Trainer, because the groups that we trained the first year, at the end of the year, they said, all right, when can you come back next year? Because we got new staff. And we thought, you know what? We're never going to get past these original organizations. We need to let people become trainers. So we created Train the Trainer. And then I've written teacher trainings, healthcare. In November, I'm training 800 people for the state of Florida, Anthem Health. It's all their call center. It's all their telehealth. It's a medical group that is federally funded. Medicaid is what pays for those services. But so much now through COVID is all being done through technology. And I'll be training all 800, their whole team in the state of Florida, through virtual trainings, and more and more and more people wanting their professionals to be trained. So that's what we began to do here locally. And then we started getting together, and we didn't make it complicated. I've worked for the city government, I've worked for a university, and when you have to navigate contracts and things, that's complicated. So we just said, hey, if you come to a training, come to our meeting every other month. And we just started collaborating. And then when we got together, our meetings did two things. We did more coaching. We gave some more education. Sometimes we would bring in somebody that was doing things in education or doing things in medical, and we began to give some education. And then we did cheering. And when Mike came to visit, he came to one of those meetings, and he heard our coaching and he heard our cheering. And because sometimes these meetings are so important, they're like a family reunion. I guess you have those in Tasmania, where you see grandma or an aunt, people you don't see, but maybe a few times a year. And it's so special because we're all together. And so when we got this collaboration going every other month, what happened was it kept people encouraged, because they would go back into their work, and the people above them would say, oh, that's not important. We just need to do things the way we've always done it. But when they came back out to the collaboration, they began to see, yes, there are people making progress and strides. And fortunately now in the United States, now national doctor groups are talking about it. Just last week, I trained nurses in 58 hospitals across the state of Tennessee that are PICU nurses. They're pediatric intensive care nurses, all across 58 hospitals in Tennessee. So more and more, the people that the supervisors respond to, they're getting the messages as well. So we advocated, educated, and collaborated. Now, for the last few minutes, I'm going to show you what happened. And this is just a tiny part of our story. And this is the part I never saw coming. All I did was have a lot of energy, passion, and put the message out and hand the glasses to these groups. And then here's what happened. So the Boys and Girls Club, I'm actually on the board of directors of the Boys and Girls Club in my town. And it's an after-school program for at-risk kids. And we have about 200 kids that come every afternoon, and our staff help them with homework and play, and they have healthy snacks. And many of these kids come from a single parent home. And I know as a board member, we used to have a list of kids that if you caused so much trouble in the club, you were put on that list and you couldn't come back. But you know what? That list doesn't exist anymore, because we know kids that have the toughest behavior, that we need to find becoming a trauma-informed center. We found new ways to hold kids accountable, and we hold them closer. We don't kick them out. We know they need us. They need our healthy support. They need these healthy relationships. So we created a calming room. We wrote a small grant, and we decorated a little area that kids can go in to calm when their emotions are big and they're acting out. Then we have a trained worker in there and begin to talk to the child. What's going on? And you know what? 9 times out of 10, daddy didn't come home last night. Mama lost her job. Mama's in the hospital. We see it connected to things. And now this has become so popular. All the clubs in the state of Tennessee, most of them have come one by one by one, the leadership, to visit this calming room. And many of them now are putting calming rooms in their club. And then our libraries, this was really one we didn't see coming. We started holding meetings in libraries. My police meetings were held in libraries. And when I started training different groups, we just used space at the library because it was free. Well, guess what? Some librarians snuck in our training on their breaks and on their afternoon off. And then they started thinking of how many people come to a library. And when they turn off the lights at night, there's runaway youth in the library. There's women hiding from a domestic situation where they're afraid to go home. And so they started doing things in the library. They started a mindfulness coloring group with a senior citizen. It was just a pilot, and it went so big. Now it's a standard program when they can come together. And they started serve and return reading groups for young children. The staff started making take-home bags to encourage the parents in parenting skills. They started a teenage hygiene drawer, and they started partnering with the university to put social workers there to help homeless that come into the library begin to have clothes and to connect to services that they need. And the churches started putting together these little blessing bags, all this in a library. Oh my, and then we had a group that kids in state foster care. This little couple went to adopt a little child. This is the little child there in that picture, Isaiah. And when they went to adopt him, or when they went to pick him up in foster care, the state Department of Children's Service worker said, this is where this little child's going to spend the night overnight until you're ready for them. And the woman, she started to cry, and she said, wait a minute, this little boy is going to just sit here in an office overnight? And the state worker said, well, we don't have anywhere for him to go. And so this couple started a nonprofit called Isaiah 117 House. It's named after little Isaiah. And it's a biblical reference also to Isaiah 117, which says that God will be a father to the fatherless. And now they have homes springing up in dozens of states. When I was just in Indiana earlier this week, they have some in Indiana coming. And this just happened, the first one in 2017. So what they are is a trauma-informed, they're a resource for the state, people in state custody, that they bring the child to these homes, and the state worker works and gets the paperwork while volunteers give the child a bath, and they have clothes. They send them out with a little suitcase full of $300 of clothes because they come in with nothing but the clothes on their back. They have food, there's toys to play with, and these children are loved on because this is a tough day in that child's life, being taken out of their home, put into state custody. And what Rhonda and Corey, the couple that started this, they found is that that's not that child's fault. And so now they're loving, their slogan on their t-shirts and their ball caps says, love, you're not alone. And that's what they're doing in this outreach to these little children. And then we started doing proclamations. The lady in the middle there with the glasses, Margaret Fire Robin, she's a mayor. And we started working with schools and United Way. And we would do mayor proclamations, and they would issue a proclamation, ACE Awareness Month. And then we would show a film, and we would offer trainings. And we were just trying to make more noise, and get more people coming in. And then this girl, I trained her several years ago, and she was a member of our collaboration. And she worked at Park and Rec, where people just come, kids, and play softball and soccer. But what she noticed is that the young teens that were 12 and 13, when they would come in for their soccer practice, they always had a little toddler with them. And what she realized is that many of these young teens were being left to practically raise their younger siblings. So there's a course in the United States called Safe Sitter. And many people that do nannying and babysitting on a professional, they always get a safe sitter certification so they can do the Heimlich maneuver, CPR. So she started going out to churches and asking who would contribute $25. So she started giving safe sitter classes to these young people because she knows they're raising the children. And some of the work they did, it made the New York Times. She even had the BBC calling her wanting an interview, and she created a mentoring program, and she got business people and church people in the community to volunteer time to be mentors. And before COVID, I went and trained one night all the mentors. And even during COVID, when they couldn't open the office and she couldn't reach out to youth, you could go by her office and there was a great big Rubbermaid plastic tub outside the office, and youth could pick out films and they could pick out books. And she was encouraging them, even though it was COVID and they couldn't meet, she was still finding ways to encourage them. And then here's Topper Academy, what Mike talked about. This alternative school was very violent. These were kids that they would not allow them to go back into the traditional high school because of bad behavior. And in the first year that we gave the trauma lens to the teachers there, they filled this little bulletin board on the left, that one with the pink border. They made it these little Topper hats because the school is called Topper. And the guidance counselor said to the kids, 140 kids are there every year, about 140 high school students. And she said, every time you earn a credit, in other words, they're failing out because of their behavior and they're missing school. And then she said, every time you recover a credit, I'm going to put your name and the date and whatever subject, if it's algebra or geometry or history. And what her thoughts was she would fill that pink board, because before they were trauma informed, this school, out of 140 kids, they would graduate about 10 kids a year, and they would recover 200 credits per year. 140 kids recovered 200 credits. Well, look what happened to that room. The first year they recovered 1,155 credits, and attendance went from 55% to 90%. Because the school became a place of hope and inspiration. And they ended up graduating 65. Matter of fact, the main school said to all the teachers, don't send them to Topper unless you have to, because they're going to graduate. In other words, they started seeing this success. And this is our local newspaper. And they came and interviewed the team and all. And they reported it was a top story that day, said, the value is restored at Topper Academy. And then I've trained thousands of teachers, and more school culture begins to change by they teach kids now, if our school is not going to have bullying, because sometimes kids bully because they come from a hard place at home. If our school is going to be kind, who's going to make it kind? And they let the students stand there in those letters and show that I will be the one who helps this school be kind. And then this is a scene here with the incredible of libraries that now have a hall of hopes and dreams, because one of the greatest travesties of trauma is it robs kids of having hope about the future. In the United States, the second leading cause of death to children ages 10 to 17 is death by suicide. And that's just, the CDC calls it death by despair. And so now when schools are becoming trauma informed, they begin to talk to kids about what's our dreams, what's our hopes. And now they have them hanging in the Hall of Hope and Dreams there. And then this is a school, an elementary school, that 7 years ago, before COVID, it was the bottom 2 schools in the state of Virginia, the bottom performing schools in the state of Virginia. And the new principal there, Dr. Faith Mabe, she learned about trauma before I ever met her. I just went out and heard about her work and went out, and now she's become a dear friend and took photos and all. And she began to train her staff. And this little pink chair, this is her office. And she began to tell the kids, now, if you act out in school, you're going to come to the principal's office. But she said, you know, when I'm having a hard day, my favorite place to chill out is at the beach. And so she said, when you come in my office, there's a beach. And so she brought in this beach towel and this little chair, and she got a jar that had pickles in it in the cafeteria, and they washed it out. She put some sand in it and shells. So when the kids come in and they're all upset, she said, have a seat at the beach. And those kids will reach in that sand and hold the shells. And what is she doing? She's calming those children down. Yes, there's going to be accountability. Yes, we're not going to let kids run the school with bad behavior, but now we're holding kids accountable in a different way. Because if we kick them out in kindergarten, in first grade, in second grade, what are we doing? We're cutting off the healthy relationships they have at school, and we're sending them back home where likely they're going to experience more trauma. And so she has the little beach in her office. Then she has this little peace path on the playground. When kids get in a disagreement, she has them doing conflict resolution like a game on the playground. And then I trained a bunch of high school students in 2019. And those students, they didn't say one word for the whole 2 days I was there. I felt that I was the most boring person they probably ever met. And right before I got ready to leave, I said, has anything I've talked about with ACEs and trauma, does this mean anything to you, Elizabeth and High? And then it was like a dam broke. They just began to talk, and they said, oh yes, Miss Becky, you need to come see the counselor's office. And they took me to a supply room where they had just got money at their school to have a counselor come 2 days a week. And the school counseling room was in a mop room, and all the stinky mops and the brooms and the custodian, the buckets, it's all in there. And the counselor, and they said, Miss Becky, would you want to talk to somebody on the worst day of your life in a mop room? So these students, just after getting the glasses, the trauma glasses, what they did in their own budget, they got a budget. They got paint colors, they found a little piece of furniture, soft lighting, and on their Thanksgiving break, they asked the principal if they could come in and put this room together, and they made a soft little counseling room. That was what high school students did. And then they created a program that they talked to the young students, and they said, draw on this mask how you think people see you. And it was things like, I'm strong, I'm confident. And then they said, put inside the mask how you see yourself. And they thought of this, how to help teach the younger students about trauma and how they began to support each other. And then when I got recruited by healthcare, after our work was recognized as a national model, I began to train hundreds of teachers, because in my mind, I thought, if we want to improve health in the healthcare system over the next few years, what would be the best way to do that? And I thought, by creating trauma-informed schools, and in the very large territory, we have 50 school districts. So I began to train them, and we began to see the schools put in sensory hallways, calming corners, and look what they did in this other high school. So the high school students, when they learned that some of their classmates, the reason their clothes were smelly, the reason they didn't ever wear clothes, now they know it's because they don't have support at home. So these high school students at Chilhowie High, they got out into the community and they got in clothes donated. And then they asked the principal if they could buy a washer and a dryer. And these high school students run a laundry program to wash the clothes of the kids that come from a home where no one is properly taking care of them. And then they started a program called Suds for Buds, and they have deodorant and shampoo. And this is just what happened when high school students got the glasses of trauma-informed lens. And then our domestic violence programs, many of the women that come in, the victims that come in the shelter, they only come with the clothes on their back. And the church community started making these little suitcases filled with different sizes of clothes. And then we started training police and started a program. Our whole state's doing it now. I mean, we're working on it, but our governor passed a law called Handle with Care. And basically, it's a program that the police understand about trauma, and the schools and the police and the schools. If police are somewhere where children are present and the trauma occurs, like a car crash or a parent is arrested, they just send a note to the school to Joey Brown, Handle with Care. And they don't talk about the details, but this just lets the school know that if the next day the child is acting out or they're sleepy, then they just know that they've been justice involved and maybe the children have witnessed some trauma. So we're training police. And then we started training our churches, our faith-based organizations, because sometimes people have been traumatized in the faith-based groups, very sadly, while they look to spiritual authority when they're very vulnerable. And sometimes they were victimized. And then other times people are reaching out in the faith community, and your faith community needs to develop skills for how to help people that have experienced trauma. And then while I was still at the police, Dr. Clements, they began to take off there at East Tennessee State University, and they began to come out of the College of Education and Counseling and Business, and they formed a group called the Strong Brain Institute. And then back to Mayor Fire Robin that made the proclamation. She was one of the mayors. They started a program to reduce trauma in the workforce. And so if you're working a job and the wages are not that good and your rent is due on Friday, but yet you have 2 flat tires on your car, now they have navigators in the human resource department that can help you find community partners without shaming or blaming, so that you don't have to mess your job up by missing your rent or not being able to afford your tires. And there's much more I could say about that. And then our St. Jude's Cancer Research Clinic for children, they started doing change the pain protocol, because they knew that they shouldn't have to hold children down and physically restrain them. And they were able to change to a cream that medicated the children. And they'd never used it before because it took 20 minutes. And now they're fully convinced that that's 20 minutes well spent because of not having to restrain the children. And then they started a little class when 5 children went through chemo for 2 years, and then they all were in remission, all in a healthy place. And so they started, we're getting ready to start school, and they knew none of these kids had ever been to school because of having their go through cancer treatment. So they got the parents to bring them into the hospital, and they taught them how to go to the cafeteria and order food and open little milk cartons and line up and raise your hand and find the bathroom. All that happening in a children's cancer research clinic. And then here, when I went to healthcare, I began to train hospital staff, and we had a huge conference. 700 people came out to learn about trauma informed in healthcare. And then my last one here, before I left Ballad Health to start out and do my consulting work on my own, the CEO of Ballad Health asked me to come to his office. We have 22 hospitals in 3 states. And he asked me to start a conversation with East Tennessee State University that in March of 2020, before I left Ballad, they gave $1 million to ETSU to formally fund the ETSU Ballad Health Strong Brain Institute. And here's my last slide. And it made the headlines in our newspaper, not just a little article, but in 4 years, through the lady in yoga pants at the department store making a lot of noise, this is what happened. And so, I'm here to encourage you today that these things, and you all already have a lot of momentum, the work that TANA's been doing, and some funding beginning to come. And so I'm just reaching across technology to give you a big high five tonight or this morning, and show you what happened here. And the work just continues to grow. So in 4 years, it's become regionally accepted that trauma in children must be addressed. So if we have any questions, and there's my contact, I'll turn it back over to you, Sue.
Thank you, Becky. I can't see our participants visually because we've got your shared screen, but I'm sure that we're all just wanting to give you the biggest round of applause and messages of gratitude. And I would love for people to, I mean, it's just incredible that message at the end that you did it in 4 years. It's made front page news in your region. You know, it's so encouraging, and there's just so much information for us all to take away.